All right. Hi, everyone. My name's Mandy Ashley. I'm the director of the Aurora Health Alliance, and welcome to our virtual behavioral health series. In this series, we're covering vulnerable populations during COVID-19. First, I wanted to say that this is sponsored by Colorado Access and Signal Behavioral Health. So thank you to those amazing organizations for your support. Also, thanks to AHA staff and our volunteer planning committee. This is the last of 4 events in our series. Today we are focusing on domestic violence, and like usual during this series we will send out a short evaluation right after the meeting. Now I'd like to introduce our 4-member panel. Each panelist will present for less than 10 minutes because we'll conclude by 12:45. We will do questions at the end of the entire panel. So please enter your questions in the chat function as they come up. First, we'll be hearing from Jennifer Eel, LPC, licensed professional counselor and Juris Doctorate, who's the I won't read all of the credentials and titles. Next, we'll be hearing from Sergeant Todd Aschler. I even practiced this before. Sorry, Sergeant, for any mispronunciations. Then Zanya Dawson with Asian Pacific Development Center. And then finally, Cindy Collinsworth, LPC and EMDR trained, which I believe is eye movement desensitization and reprocessing trained. So Jennifer, you're up next. I'll let you all know when you're sitting at 8 minutes, just to be mindful of the time. Thanks.
Great. Thanks, Mandy. And it's Isle, Jennifer Isle. That's okay.
Apologies.
That's all right. Everybody gets that wrong. I'm the executive director of Project Safeguard, and we are an organization that provides services in Denver, Adams, and Arapahoe County. So we cover all of Aurora for victims of domestic violence. And our main service is what we call legal advocacy. So when clients come to us, they are often looking for a civil protection order or they have some other legal need. But that is not any kind of prerequisite for us to provide services. We really start out everyone with safety planning, with really looking at what steps does someone need to take to ensure their safety today. And a protection order is often a component of our safety plan, and that's part of our expertise. So we have victim advocates, legal advocates specifically, in the Aurora courthouse when everything is operating normally. Of course, I'll talk about what our remote operations look like, but under more typical times, we have 2 advocates in the courthouse in Centennial that will work with the county court protection orders as well as whatever other needs a victim of domestic violence might have. One of those advocates speaks Spanish, and then we can access other languages through Language Line or through the translation services at the court. We also have a bilingual advocate in the Adams County Courthouse that provides those services. And then we have 2 advocates in the Denver County Courthouse and 2 at the Rosandum Center, which is the Family Justice Center located in downtown Denver near the courthouse. And we will serve clients from all counties there. In addition to our legal advocates, we have 2 full-time staff attorneys who can provide legal services, legal representation to our clients. And we have contract attorneys who can represent our clients in their protection order cases. So our legal advocates can help clients get into that process and get their protection order filed. And then we can assign an attorney if the client is interested in that, and we have an attorney available, and we cover all of those costs. We also can provide assistance and representation in divorce and custody, landlord-tenant, and really any other legal matter that comes up for a victim whose legal matter is connected to their victimization. So our current operations, like probably all of you, are being done remotely, mostly by phone. If you've read much of the news coverage about how staying at home is impacting domestic violence victims, you might have seen some reference to the fact that it's really difficult for survivors who are still living with their abusers to access any kind of services right now because they are at home with the person they're trying to get away from or create a safety plan around. So most of the clients who have contacted us lately have wanted to do their contact by phone, not by video. And there's been we do a lot of email. We are able to do texting through our phone service, but it's been very challenging because we primarily operate with walk-in clients who come into the courthouse or into the Rosandum Center seeking services. Trying to reach those clients, trying to make sure that they know that we're still available or even know that we exist has been a challenge. We have asked the clerks in each of the county courts where they are still issuing protection orders. That is one of the emergency services that the courts have been required to continue to provide, to include our information when they provide paperwork to petitioners in these cases. So ideally, if people are interested in our services, they're getting our information and able to contact us. I think that's really the overview of who we are and what we do and how to contact us. We have on our website, which is psghelps.org, the different phone numbers for each of our locations so that folks can just contact somebody directly. If someone is in Adams County, contacting the Adams County Advocate is helpful because she will know more about exactly how things are operating in that county. Same with Arapahoe County. But if someone's just looking for general information or wants to know what their options are, they can call any of our locations. They don't need to talk to an advocate in their specific county. So I guess I will answer any questions.
I know I said questions at the end, but a couple have popped up. There's how do we refer someone?
I think the easiest thing is just to have somebody contact us directly. And let me see if I can pull up our website and show you that. Like I said, normally we would be doing walk-ins, but we are not obviously doing anything in person right now. And we're trying to keep I'm trying to keep our website up to date so that people know what's going on in the courts in all of their jurisdictions and are able to get that information. Am I able to share my screen, Mandy? No, it won't let me.
Maybe.
I was just gonna it's okay. I was just gonna pull up our website. So the main page of our website, psghelps.org, has phone numbers for each of the locations. And that's really the easiest way to contact us and to refer folks right now.
And we will put that on our website and in follow-up communication.
That's great.
We're happy to do that.
The one other thing I guess I'll add, because talking about referrals makes me think of it, is that our legal advocates are confidential victim advocates. So they are covered by the victim advocate privilege under state statute, which looks similar to therapist privilege. So we do have the ability to talk to somebody about issues they're having with their criminal case or anything at all, and none of that information can be shared unless the person signs a release with us.
Perfect. Thanks so much. I'm sure if anyone has more questions for Jennifer, drop them in the chat and we'll get to them at the end.
Great.
Thanks so much.
Thanks, Mandy.
Okay, up next is Sergeant Todd Asler.
Alsher, however, it doesn't matter. Sergeant Todd's fine. Not a problem.
Then you have slides, so I can just advance them for you if that works.
We can start at that right away. So I'm Sergeant Todd Alsher with the Aurora Police Department. Our Domestic Violence Investigations Unit Started in January. We don't have any investigators yet. They gave me a year to find best practices, meet the needs of the department and of our victims/survivors, to find a comprehensive view. Obviously, COVID has played a big part in derailing some of that stuff that's taken place. But I think we're in a good place. I'm learning that the Aurora Police Department's been set up perfect for doing it. I just think besides helping victims, we have to help officers understand what victims go through so they understand it, so the officers can show more empathy. So the first slide is our COVID stats. As you can see, we're comparing 2019 to 2020 for the same week, 7-day week periods. Overall, for calls for service, where it's specifically told a dispatcher, hey, this is a domestic violence incident, is up about 14%. It's 13.8%. The next column is reports from 2019 to 2020. They are down over the 9-week or 10-week period about 8% or 7.3%. Now, the reports number is physical case numbers police officers pulled, whether there's a criminal allegation and they made an arrest or not, but it's that we physically documented something other than a note in a computer. So they're down. And then obviously arrests are down, and they fluctuate, but they're down about 23%. They're harder to follow because there's no way to tell if these arrests are down because victims are harder, or suspects are harder to find, or at the time someone wasn't there. So, and we're not following, these don't follow, this is at the time the report's taken, not if detectives went out and filed a case and made an arrest. So we're seeing higher calls for service. Our idea or theory behind it is that there are more people that are first-time victims or experiencing a hardship of being stuck at home with someone for 9 weeks, and are reaching out because really the only services, the immediate is 911 and officers are being dispatched to. We totally understand that we are probably going to have significantly higher numbers of after the fact reports coming in, and that we're going to have to be following up and working harder to make arrests. So that's just where we're at with the police department. Particular challenges for victims, as Jennifer has stated, getting resources to those victims. We understand that it's extremely hard. The term we're using is, with COVID, you have to either learn to live with the devil that you know, which is the person at home that's abusing you, or you have to risk learning the devil you don't know, reaching out for a service or calling the police. And either one, the police don't make the arrest. The courts are giving PR bonds now because they're afraid of suspects going in. So victims absolutely don't have that respite period of 72 hours, which we understand is, I feel, inappropriate. And then also, where are you going to go? If they go to Gateway Domestic Violence Services Shelter, what's their risk for contracting a disease that we really don't know about right now? Gateway has informed me that they're 3 times what their resources online and telephones are, but they're lower in providing shelter, which attributes to our stats. We also know that COVID allows, with the news, abusers to abuse even more, limit transportation, limit funding, financial impact of, well, I lost my job, you can't go out, or look, I'm just doing my part. You're not allowed to go to the store. You're not allowed to go visit your family. You're going to put us at risk. And then children and pets exponentially increase those emotional responses. So the police department understands stress is through the roof for victims and survivors right now. So some of the things that we're doing that were innovative solutions besides our new DV unit, if we can go to the next slide, we're doing a public campaign to make DV a common topic in social atmospheres. If you can see right away, we're telling people that we can respond to telephone or text to 911. It also gives emergency numbers that are commonly used, 24-hour hotlines, Gateway Domestic Violence Shelter. You can see Project Safeguards on there. Partnerships that we use. We created this nice little QR code at the bottom. And so these are going to go in all of our businesses' stalls, at cash registers. They're laminated. Victims can scan it. They don't have to worry about having this card in their wallet and the abuser finding it. And that QR code will immediately take them to our victim advocacy page. All of our victim advocates' desk phone numbers, our hotlines, all of our other 72 other resources, including emails, to get them the resources and the options that they need. Our other response to this is we want victims to know that they don't have to seek from the city resources by calling the police, because sometimes the police isn't the perfect response. And I understand that that's an option. We want to get them to safety first. And if we have to, our advocates can be a roadmap to, hey, we can't provide this because you haven't reported it, but let's get you to Project Safeguard. Let's get you to Gateway. Let's get you to Aurora Mental Health. It's really to provide resources to the victim, let them make a choice. And then on the police officers' end, we're trying to train police officers that our job's not to judge. It's their choice. It doesn't matter if it's the 10th time we've been out there this week. The situation is different. We document it. We show empathy, and we try to present the best case that we can, and then also provide victim services. So that's where we're at. Some of these went out yesterday. I'm putting them up myself because I don't have anyone working with me. I can definitely email these to whoever they want, whoever would like them, either larger QR codes, or you can print them yourselves and put them at your businesses, places that you want to put them out. We just request you email me letting me know where they're at. So if we have to take them down, we know that they're taken down.
Yeah, we had a couple of questions on where can we get flyers, where are they posted?
Okay. So
you can send them to me and we can distribute them too.
Absolutely. Or the next slide is all of my contact information. Perfect. If you want to call, email, you can even scan the QR code off your screen. It'll take you right to Carol O'Shea's Victim Advocate page. Right now, currently, they're at all our library. They're going to be at all our libraries because they're not open yet. They're at all our police stations. And then starting Friday, I'm going to major trusted businesses, right? So Walgreens, grocery stores, etc. Our parks, our rec, as they slowly open up, we want victims and survivors to understand they're not alone. They can reach out to us whenever they want. And then whoever else puts them up, they're being translated into Spanish now. It's a difficult task for us to try to do that with the graphics. So bear with us. And then if communities believe it's working or it's good for them, we can get them translated into any language. We own this. We can have them printed within 2 days and shipped out.
Great.
And then there's obviously all my contact information. That's my good email. It goes directly to my phone, working from home, my computer. That's my office line and my work cell phone number. It's just a Google number. If I don't answer, it's not appropriate, but it does transcribe everything into my email, and I'll get back. Being that I've been a police officer for 17 years, the reason I was selected for this case was the Allie Raber case in Aurora, where she was murdered in 2017. It was really my first week on my own as a sergeant when I found her in a bathtub. So I'm dedicated to learning. So if I've said something that isn't correct, needs to be corrected, or a point that you think we should be as the Aurora Police Department expressing, please email me, call me. Any criticism, I'm not going to get upset. We're trying to turn the culture of the police department around as, no, you need to do this, and if you don't, we're not going to be happy, as to, here are your resources, we're here for you, and believing first. So again, any questions, comments, if you don't want to do them here, please email me, call me. They always work.
We had One question, how is domestic violence called triaged by the police department?
So we use, right now, I'm not a fan of it. We use a system called ProQA. We're trying to get away from it. There's specific orders of questions that they have to ask. But as soon as it's known as a DV, dispatch sends it to 2 officers. It's documented as a DV in the call notes. The issue is sometimes the information is not forthcoming when officers get there. They have to determine if it meets the criminal statute of what it is. And that's one of the things that I struggle with, is there might be 2 different definitions of domestic violence, and officers strictly stick to the criminal. And then we have some of the other that might not meet the criminal statutes. So it gets classified in there as a DV or a domestic violence, and then the root problem, whether it's a theft, a burglary, an assault, harassment, stalking. And then the officers go from there, and depending on what their investigation, it determines whether it goes to community court, county courts, or at some point come into my unit for us to review.
Thanks. And then how are relationship abuse or violence dealt with for individuals under the age of 18 for you all?
So everything has to go county. Obviously, we can't do it muni because our muni courts are very financially restrained and to an extent legally handcuffed with some of the things they can do. They can't order guardian ad litems as well as counties can do. They can't order mental health programs and evaluations. So all juvenile DVs, if there's an injury, will be coming to our unit. We're going to do mostly felonies, but because there is special circumstances with juveniles, they'll be coming to our unit, and a detective will be taking a look at it.
Thanks. Jennifer actually had a question, and Jennifer, do you mind saying the
I know
acronym?
exactly.
I don't know what it means.
Okay. So do officers use ODARA or lethality assessment of some kind?
There you go.
So Jennifer, right now we use a non-scored Maryland-based system. It's just on our own form. I'm not sure why it's never scored. I just got certified about a month ago on ODARA. I've been talking with Jefferson County because it seems they like it. The issue that I have, and this is a personal opinion, and some of you might share it. I don't know if there's anyone from the court system here, so if I apologize. Quite frankly, the judges and the intake don't really bother with it. They're more worried about what's it look like if we're posting too high of bonds on suspects. I personally like ODARA better. I think it's scored better. I think they support the language in reports. But currently right now, our victim advocates, Lisa Batten and Ann Dorr, are reviewing, doing the research to figure out which one is best liable for the police department to protect us. But that is one of the things we definitely want to do, is have a score and be able to retain that and be able to present the judges so they can't say they didn't have that information at the time of arraignment determining bond.
Thank you.
Absolutely.
Okay, if there's any other questions, you can drop them and we'll get to them drop them in the chat box and we'll get to them at the end. Thank you, Sergeant.
No, thank you.
Okay, up next is Zanya Dawson.
Hi, everyone. I am Zanya Dawson, the Victim Advocate Coordinator with the Asian Pacific Development Center. And the Asian Pacific Development Center is also part of Aurora Mental Health. So we're kind of a subsidiary. So for those familiar with Aurora Mental Health. So our center is kind of a one-stop shop for folks. So I'm here today to represent our victim assistance department, but we have a behavioral health department, adult education, in-house interpretation and translation, youth program. So we're doing a lot just under one roof. So like I said, we hope to be a one-stop shop for folks. So right now our building is closed, but we are providing all services remotely. And it's definitely been a challenge. I think if we want to talk just, today, right, DV specific, the lockdown and the virus itself has just amplified the barriers that our community already were facing, right? So one of the biggest ones is access to language and access to technology. So a lot of our community members are unable to contact us because they're unsure if someone's going to speak their language. And we have a 24-hour crisis line that is also connected to a language line. So of course they can, and of course we'll have the language, but not everybody knows that. In the past, a lot of our referrals were through law enforcement or just folks walking into our door. So now that that's not a possibility, it creates just another barrier. So through our 24-hour crisis line, we also have a text line. So that's been helpful. We have found that a lot of our community members that are English second language speakers feel comfortable texting, right? When they can kind of take their time, they're able to speak to us in English, even though, that's one of the first things we ask folks is, do you need language access? And then we'll make sure to get an interpreter or translating their messages that they send us. Another one, because so many people are locked inside their homes with their abusers, sometimes their only form of communication is through Facebook and Facebook Messenger. So that's something we've created is a separate page that folks can Facebook message us, right? We know it's not HIPAA compliant or anything like that, but it's a great access point where folks can say, hey, this is what's going on. And then maybe we can then introduce other forms of communication. We also, our community's really been faced just a lot of hate crimes. So there's a lot of, it's one thing leading to another. Unfortunately for the communities that we work with, it's not just one thing, right? It's not, I'm a survivor or a victim of domestic violence. It's the fear of leaving their home, not just because of the virus, but because neighbors are leaving notes on their doors, right? We've heard a lot of cases about that, notes on their car, or just the news talking about how folks that look a specific way is just being targeted, right? Because of just what this virus and some of the rhetoric around it. So we've definitely tried to be there for our community members as much as possible. That's why we have the text line and the Facebook Messenger where they can reach us directly. And we also have started doing food boxes and care packages. And in those boxes, we're putting information on how to contact us in the language that we know the family speaks, right? So whether that is, Somali, Burmese, Vietnamese, whatever the case. So that maybe they were not involved in our center to begin with, but now, let's say they're unemployed or they're looking for that food access, we're putting that information in. Now they can contact us for some of those things. And there's a great Times article that came out that talked about domestic violence in the time of COVID. And one of the most staggering statistics that was in there was that in China in February, when they had the lockdown, DV tripled, right? Cases of DV tripled. And what's really interesting is we've seen a decrease in referrals. So we're trying to understand that we know it's happening, right? But why are folks not reaching out to us? So that's, even with Facebook Messenger and the text line and these food boxes, we're still trying to come up with more innovative ways for our survivors to be able to reach us and get services. We've been doing more hotel stays than ever, right? Because some shelters are not taking in new clients. And again, right, these barriers that have always been there for our clients who are mostly English second language speakers have just been amplified, right? They may not feel comfortable going to a shelter because they don't speak English, right? So yeah, I could definitely go on forever, but one of the things I do want to make really clear is that even though our name is the Asian Pacific Development Center, don't let that fool you. We serve anyone and everyone. They do not have to be of Asian or Pacific Islander descent, and they do not have to be an immigrant or a refugee, even though we say that we are more well-versed in those issues, but you can definitely refer anyone to our services. And Mandy, I see questions coming in. Would you like me to address them or maybe later?
Sure. Just read the question so people know what you're talking about.
Wonderful. So first question is, how can we support community members experiencing hate crimes? Yeah, that's something we're still struggling with. We've definitely partnered with Aurora PD. It's a lot of it starts with a hate incident, right? It starts with a note. It starts with a threatening Facebook message or even a message on Nextdoor or something like that. And our community members, unfortunately, have a fear of law enforcement. You know, whether that's through, you know, their own personal history or sorry, just history of their family's experience with law enforcement, maybe in their country of origin. It's been really difficult to, quote unquote, convince our community members to take it to law enforcement. We have found that our community members are purchasing guns when they've never held a gun. They don't know how to use one, but that's the only way they feel they can protect themselves and their families. So definitely we have navigators on our team. So we try to get our navigators into these communities to really say, it's okay if you don't feel like calling the police or that fear is there, come to us and let's figure it out together, right? Let's do some safety planning. Or what really helps is if we say, hey, we have a trusted officer or a trusted sergeant we work with, then folks feel a lot more comfortable than saying, okay, fine, then I feel okay making a report or something like that. And then the next question is, what resources are available for victims with children? So I'll only speak for APDC. So we will treat the child like separate to, like as another survivor, right? So we address the needs for the parent and then whatever the child needs. It's so hard, you know, to say we do ABC. We will do anything our survivors and our victims need to move forward from what's going on. So that can mean helping relocate, helping them sign up for a new school, helping with school supplies, if they're younger, right? Diapers, wipes. We definitely help with childcare. And of course, we have our in-house behavioral health team to make any internal referrals if the parent or the child feels like they need that mental health support.
Great, thank you so much. If there are any more questions, drop them in the chat box and we'll get to them at the end. Okay, our final panelist is Cindy Collinsworth. And let me know if I got the EMDR.
Yeah, that's fine.
Correct.
Yeah.
Okay.
Hi, y'all. I'm Cindy. I work with Heart-Centered Counseling. We are a private group practice. We have several locations throughout Colorado, mainly northern Colorado, a good part of the metro area, throughout the metro area, and then actually in Colorado Springs. All of our practitioners kind of work in several different specialties, so many of which do a lot of work with DV victims. A lot of times, though, by the time we see them in private practice, they may have gone through the legal process, and so we're doing a lot of work with them post, like, the big ongoing events, but also helping them manage ongoing contact if there's kids involved, and there's separation and divorce and things like that, but I'll kind of get into that. So we kind of come from, I know Todd had mentioned, like the police department really comes at it from this criminal description. The clinical piece really includes physical, sexual, emotional, financial, and spiritual abuse. And, you know, domestic violence definitely includes that partner abuse, but also abuse within the family system, kids abusing parents, parents abusing kids, which a lot of times Human Services handles, things like that. It's always about control, as most of us know, And definitely during this time, the big triggers have been loss of income, uncertainty about the future, not knowing how to manage relationships within the family unit because one or more of them almost never see each other, whether it's school activities or a parent being at work all the time. And then mental illness. Mental illness is a huge factor in a lot of DV cases. And so one of kind of looking at different resources, the National DV Center, some resources here in Colorado, some of the things that people had pointed out were reports of partners withholding basic needs, which is part of DV, like hand sanitizer, disinfectants, refusing to give them access to insurance cards, or threatening to cancel insurance, not letting them attend appointments. One of the biggest obstacles, I think, to therapy, and I'm sure other medical appointments, has been like not feeling comfortable or not having a safe place to meet with a provider where they're worried that somebody could be potentially listening in. And we've done some work around like meeting in cars if that's an option, but sometimes cars are not an option because the abuser is refusing access to a car. We've taught, like, I've had some clients out on walks with me, so they, you know, and that's a little distracting, but that we definitely have done some of that. Issues with, like many of you have referenced, lack of access to medical services, especially with chronic issues like diabetes or lung disease. And then kind of this piece of trying to further isolate them from family members or other community services. And like some examples where like an abuser basically told a victim that they would refuse access to their kids if they talked to their therapist. And another one was refusing access to visit their family. And then kind of just the physical threat of physical abuse to them or the kids if they weren't under their control. And most of these are kind of fall within the realm of what we know happens and has happened outside of COVID, but definitely using COVID specific examples with that. A lot of the cases, like I mentioned, and specifically recently with myself personally that I've worked with, have been around helping victims survive or move out of major DV situations. And so in the middle of the separation or divorce process and the ongoing psychological and emotional abuse that's happening, and helping them to manage that even if they're not in the same location. Denial of financial or basic needs, like getting them connected with community resources like you guys or churches, other family members as much as possible. Although in Colorado, that's a hard issue because we have so many people in and out of Colorado. A lot of people don't have family. And so we're definitely more dependent than other states on community resources, maybe. And so this piece of helping them access, like for instance, one of my clients is really involved with her church, and her church has come in and provided that, that financial stability when the spouse refused to pay for basic needs for her and the kids during the divorce process. And then kind of this ongoing piece of treating the actual emotional symptoms, you know, the low self-esteem, the really shy or meek, apologetic piece, lack of confidence, being constantly fearful or hyper aroused, feeling agitated, anxious. They might even be tempted to engage in some of those abusive behaviors themselves, and reporting excessive anger. And you know, it's not uncommon for a spouse who's being abused to say, today I almost hit my kid, you know, like, and kind of doing safety planning and walking through coping tools around helping them manage that. Definitely increased suicidal ideation, and engagement in self-harm behaviors. We also have been seeing an increase in eating disorders, especially with women. Men aren't as likely to report, but like I've been dealing a lot with that in conjunction with the DV ongoing issue. And then the ongoing isolation and trying, for those who aren't involved with any kind of community support or family, getting them connected to supports. And just really working with them around that safety planning process of continuing to make sure that they can establish a safe place. One of my clients in particular, we've been doing work around her bedroom has never been a safe place because there was some pretty massive sexual abuse, and kind of reestablishing she's in a new place, a new bedroom, it's hers, there's an established safety, like at least physically, but she's still in trauma brain, and being able to get her out of that trauma brain through a screen and help her use like her 5 senses and to help establish a place of safety in her room, make it hers. We've also been doing a lot of like cognitive behavioral and DBT work, that negative thought replacement, and then kind of that mindful thinking cycle. And there's EMDR is definitely a part of the process. We definitely can't do EMDR when a client is in the midst, or I would say best practice is when a client is in the midst of a constant crisis or in the midst of ongoing abuse. EMDR is not necessarily an appropriate intervention, but using EMDR to help clients work through trauma has been helpful. It's a little harder to do via teletherapy, which everyone has been, and kind of this last piece of really using interventions that for each client that are appropriate. So I think that covers most of the clinical approach to things.
Okay. Thank you so much for all that you do and for sharing that with the group today. I'm gonna give just a moment if there are any other questions, and I think Troy was helping me monitor the chat if I had missed any. If the panelists, any resources that you mentioned, we'll do a follow-up just to make sure that we can share those with the group and with the AHA membership. Okay. Thank you, panelists, so much for your time and the work you do in this area. I wanted to let the attendees of this event know that Aurora Health Alliance is moving forward with a behavioral health interest group. We're going to be meeting quarterly to discuss behavioral health topics and resources in Aurora. So look for AHA notifications regarding that interest group. These sessions have all been recorded and will be posted on our YouTube channel and on our website. We'll share those with you. And I hope everyone has a good remainder of your isolation week at work. There are a bunch of thank yous rolling into the panelists, so thank you all. We'll see ya.